when we have obstructive sleep apnea. Because when you have obstructive sleep apnea, there is only one way, is to use nasal CPAP. Who want to have a machine as a girlfriend or for a boyfriend for the rest of their life? Nobody wants to have that. However, that's today, if we wait till you have obstructive sleep apnea, you have a nerve disease that we don't know how to repair. So what the challenge is to do diagnosis much earlier, to recognize flow limitation, to recognize the flow dynamic changes, and the challenge, but we already know some of the treatment. We can repair, we know not necessarily everywhere. There is one or two places in Taiwan where they can do really good repair of when you have overlapping teeth by putting device on the top of your palate and so like that. We can do surgery. We can avoid that you developed a typical obstructive sleep apnea syndrome. However, to avoid that, we need to be able to screen children. We need to be able to recognize the problem much earlier than what we do right now. And the challenge is your challenge, because it's not physicians who are going to find the technique to do this type of studies. It's the engineers, it's the computer programmer, it's people who work in association with the physician to make these devices, because yes, we can avoid for some people to have a stroke, to some people to have a heart attack, to avoid it. We can recognize earlier and we can treat earlier. We need means to do that. So we need to prevent. We know that we can use medication. We can do some orthodontic treatment. We can do a surgery. We can do surgery. We can do tongue exercise. We know that we can do that. The problem is to recognize in a cheap way, to be able to screen thousands of children, to do that in school, to say, hey, you have to have something done. We don't have that. So that's a challenge for the technology. Thank you very much.